The United States of America boasts the best physicians and hospitals in the world, with the most high-tech medical treatments and interventions available. Yet the American healthcare system is plagued by inefficient, uncoordinated, and fractured care, resulting in poor quality and the highest per capita healthcare costs on earth. To address this, a new model of care has emerged, the patient-centered medical home, to ensure patients receive the right care at the right time in the right setting. But what is a medical home?
The patient-centered medical home is a concept, a model of care designed to help take care of patients over the long run.
A medical home is a complete, comprehensive practice that allows you to have access to multiple services in one location, as well as have access to the network of specialists, diagnostic tests, and other resources that may be in your community, all directed by your personal physician.
It is enhanced with electronic technology in terms of electronic medical records as well as electronic prescribing that tremendously increases safety for patients.
But what we do is we help you navigate this complicated healthcare system to get the care that you need.
I'm the quarterback, okay? That I may be sending them somewhere else for some specialty care, for something that we're not experts at, but I want them to get the best care.
The patient-centered medical home puts the patient at the center of healthcare, working with a personal primary care physician who leads a healthcare team dedicated to providing comprehensive and continuous care. In a medical home, physicians employ systematic solutions to ensure patients receive safe, high-quality preventive services and care that's coordinated across all components of the complex healthcare system. Patients enjoy enhanced access to their physician, and physicians are paid appropriately for managing their care.
People being cared for by primary care physicians in ongoing relationship in a primary care medical home or something like it get more attention paid to their health when it's still good. There's a reason they call it preventive health care. It's preventing the problems down the line, and I think it's a lot more cost effective to manage someone's diabetes well than it is to pay for dialysis or their amputation.
I believe if we can solve two things: incentivizing advanced care where people look at you in advance and they look at wellness and they take care of you and it makes sense to them, and helping doctors afford to have the electronic health record. I believe those two steps will put us into a medical home-centered model with extraordinary efficiencies and where we actually will discover we're saving an enormous amount of money and people are dramatically healthier.
Numerous studies have concluded that when primary care physicians lead the healthcare team in a medical home, patients receive a higher quality of care at a lower cost. These studies, along with medical home demonstration projects across America, are proving that increased access to primary care physicians results in lower rates of all-cause mortality, fewer emergency room visits, hospitalizations, and readmissions, less duplication of expensive services, more preventive care, and greater patient compliance, all of which lead to better use of health resources and better outcomes for patients.
When a patient is getting good, integrated, coordinated care in a medical home, their quality of care goes up and overall costs will actually go down. Now, this should make intuitive sense to everyone that if a patient gets good quality care, that overall it would prevent worse outcomes later, so it would make things cheaper.
Finding a primary care physician, the right primary care physician for you, is of utmost importance. That physician, not only are they there to take care of you, but they're your advocate.
The opportunity to create a more efficient healthcare system, improved patient outcomes, and a healthier America has generated a great deal of enthusiasm for the patient-centered medical home. No wonder it's been endorsed by every primary care organization in America and the American Medical Association, and is supported by patient groups, business, industry, and government.
The reason that the companies are in the healthcare business is they provide the benefits with the goal being to have a healthier workforce, and that translates hopefully into a more productive workforce, and that transforms into a better bottom line for the company.
Addressing the health care component of labor cost, which is the biggest component of the cost of the delivery of products and services in industry, it's an urgent life or death matter.
When you consider the growing cost of medical care across America, there are certain common sense approaches that we should be turning to. Medical homes would be one of those, to make sure that primary care physicians can be in direct touch with families on a regular basis to provide them the best and most economical health care.
Everybody deserves high-quality health care. Everybody deserves a medical home.